How to apply your HRT patches so they don't fall off. This is so common and it turns up in my clinic. The most important thing is, regardless of the brand, that you apply your patches to a clean, dry, hairless skin below the waist. Press it down for about 10 seconds and avoid applying moisturizer or sun cream to that area. Now the location is so important. You want to put them on your tummy below the belly button. So it could be on your thighs, it can be on your bum cheeks, and then you want to rotate the position around every single time you change your patch so that the skin doesn't become irritated. Now, you can safely blast your patch before you use it. So if it's still in the pack, blast it with a hairdryer, and then that will activate the adhesive, or blast it with a hairdryer once it's on, but make sure that you're careful and you don't burn your skin, or don't come for me if any harm comes to you. That's just a bit of advice. I've also had a patient tell me that she heats the patch on the side of a hot water bottle or a kettle or a mug, and then holds it there for a few seconds so it's nice and hot and it gets activated, and then she applies it onto her skin, and that works well as well. The other thing that you might want to consider are some of these options. So Tegaderm Nexacare, which is for sensitive skin, that can hold on to the patches as well, and tattoo tape, all available from your local pharmacy or Amazon. Other places are available that you might want to use, as this will help stick on the patch for you, and that can hold it in place as well. And my final tip with the patches, allow it to set for at least 1 hour before exercising, showering or bathing or sweating, because all of that can affect the adhesion. So you want to make sure that you allow it to set. So that's why the best time to change your patches might be towards the end of the evening at bedtime, because then it's just going to be there on your skin, allowing it to set while you're asleep. Then if all of those handy tips fail you and the patches just don't stick on, then it's not you. It could be that the patch is just the wrong way to give you your HRT. And it might be worth considering changing it to either a gel, such as this, or a Sandrina gel, or a spray, which is Lenzetto, or even in some cases, some patients don't get any of these preparations. It might be that they need to have an oral tablet. Look, there is no one size that fits all. So it's all about trying and experimenting and seeing what works for you, and having a discussion with your GP so that we find the right way, the right mode to give you your HRT. I hope that's been helpful. As always, leave them comments down below.